Your Excellency, Dr. Megdes Daba, Minister of Health of the Federal Democratic Republic of Ethiopia, distinguished leaders of the Addis Ababa City Administration, Dr. Tewodros Abule and the dedicated staff of the Zewditu Memorial Hospital, representative of Nutrition International, Joel, and the representatives of the Embassy of Canada, Your Excellencies, distinguished guests, ladies and gentlemen, let me start by, first of all, conveying through Your Excellency, the Minister of Health, to the government of the Federal Democratic Republic of Ethiopia our heartfelt gratitude for the warm welcome we have received since our arrival in Addis Ababa late last night. We truly feel at home, and I am delighted that I'm back in this beautiful city. It is a profound honor for me to stand here today at the Zewditu Memorial Hospital, a place where the commitment to child survival and nutrition is not only articulated in policy, but lived and practiced daily through service, innovation, and compassion. This morning's tour has been greatly enlightening. I have witnessed firsthand the forward-looking and integrated approaches Ethiopia is taking to safeguard the health and development of its children and mothers. From paperless electronic medical records that enhance continuity of care to community-based health insurance that expands access, from strong maternal and child survival programs to therapeutic feeding, early child stimulation, and follow-up services that ensure no child is left behind. What is especially commendable is the systemic way in which nutrition has been embedded within the broader health system. Ethiopia's progress in addressing anemia among women and children through routine screening, micronutrient supplementation, dietary diversification, and antenatal care integration is particularly noteworthy and praiseworthy. Anemia remains a silent crisis across much of our continent, undermining maternal health, child development, learning outcomes, and productivity. The progress I have observed here demonstrates that anemia is preventable when nutrition interventions are prioritized, well-resourced, and delivered at scale. I was deeply moved by the work being done in nutrition screening and therapeutic feeding. the professionalism of the health workers, the integration of nutrition with clinical and social services, and the dignity with which children and mothers are treated presents commendable evidence that effective nutrition action saves lives and restores hope. These are not isolated interventions. They are part of a deliberate national effort to break the intergenerational cycle of malnutrition. As the African Union champion for nutrition, I am convinced that what I have seen here today is a model worthy of emulation across the length and breadth of our continent. Ethiopia's experience shows that with strong political will, sustained investment, community engagement, and strategic partnerships, countries can make measurable progress in child survival, anemia reduction, and overall nutrition outcomes, even in resource-constrained settings. Tomorrow, at the high-level dialogue titled Recommitting Africa to Child Survival through Strategic Investment in the Prevention of Malnutrition, I will call upon our continent to renew its resolve. But today, standing here at this remarkable institution, I wish to underscore that the lessons from this facility must travel beyond these walls. They must inform national policies, budget priorities, and health systems reforms across Africa. They remind us that prevention is not only possible, it is essential, cost-effective, and transformative. Let us therefore recommit ourselves to ensuring that no child in Africa is denied the right to survive and thrive. Let us invest wisely in nutrition, maternal health, and early childhood development. Let us act decisively to tackle anemia, wasting, and stunting. And let us work together across borders, sectors, and institutions to place child survival at the center of Africa's development agenda. The health and nutrition of our children are the foundation of Africa's future prosperity, stability, and peace. This is not only a moral imperative, it is a strategic investment in our continent's human capital. I extend my deepest gratitude to the government of Ethiopia, the government of Canada, the Addis Ababa City Administration, Nutrition International, the leadership of the hospital, and all partners who make this work possible. Your example strengthens our collective resolve and lights the path forward for Africa. May our shared commitment to child survival and nutrition continue to deepen, and may Africa's children inherit a continent where malnutrition and anemia are no longer barriers to their dreams.